Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. We all know that the incidence of kidney disease and dialysis is increasing, and the most important cause is chronic kidney disease. Today we'll be discussing about what is chronic kidney disease. So, chronic kidney disease has got two features. One, the estimated GFR less than 60 ml per minute per 1.73 meter square. You can call that the patient is having chronic kidney disease if it is persisting for more than 3 months. So the time span is important. Chronic kidney disease, one of the criteria is eGFR, that is estimated glomerular filtration rate, less than 60 ml per minute per 1.73 meter square, and if it is present for 3 months, you can call that the patient has got a CKD. If the eGFR is normal, that is more than 60, there should be evidence of kidney damage. Then only we can call that the patient has got a CKD. Hope this definition is clear. The time duration 3 months. One of the following criteria, that is either the estimated GFR should be less than 60 ml per minute per 1.73 meter square, or if the estimated GFR is normal, there should be evidence of kidney damage. So now we go to how will you calculate the eGFR. This is by looking at the serum creatinine. There are different formulas are there. One of the common one is the Cockcroft formula, very simple one, you can use in the website. There are other formulas. One is the CKD EP formula, MDRD formula, and there are calculators are there. Using the calculator, by entering the weight and serum creatinine, you can easily measure the eGFR. Any patient with kidney disease, you should estimate the eGFR. So the important point to be remembered here, that this is 140 minus age. So suppose the age of the patient is 40, so it will be 140 minus 40. Let the weight be 72 kg. The serum creatinine is 1 milligram. So divided by 1 into 72. So this will be 100 ml per minute per 1.73 meter square. For female, you multiply with 0.85. Consider the patient has become 70 kilograms and the same creatinine and same body weight. Let us see what happens. So 140 minus 70 multiplied by the weight 72, serum creatinine 1 into 72. So you can see that the GFR has come down to 70 ml. So as age advances, eGFR comes down. So by simply looking at the serum creatinine alone, you cannot say that the kidney function is normal. That is one of the important concepts that you should keep in mind. Now we go into the second part. Is if the eGFR is more than 60 ml, there should be evidence of kidney damage. The evidence of kidney damage can be in the structure of the kidney or the function of the kidney. Structure abnormality can be identified by the imaging studies, CT, MRI or ultrasound. So here you can see the multiple cyst. The patient has got an adult polycystic kidney disease. So this is the evidence of structural damage, or this can be a function of the kidney. So function of the kidney can be estimated by the urinary examination or the examination of the blood. So what are the abnormalities in the function that you look for? So if the GFR is more than 60, one of the following should be there. That is, one is albuminuria, that is albumin excretion more than 30 milligram per 24 hour, or ACR more than 30 milligram per gram. Urinary sediment abnormalities, electrolyte abnormalities which are indicative of tubular dysfunction. If a biopsy shows abnormality, histological, structure already we have mentioned, imaging, and if the patient had a history of a kidney transplant, again, even though the GFR is normal, we consider that the patient has got a chronic kidney disease. Hope this point is clear. CKD is duration should be more than 3 months. There should be either eGFR should be less than 60 ml per minute per 1.73 square meter, or if eGFR is estimated GFR is normal, there should be evidence of a kidney damage as evidenced by either the structure or function of the kidney. So the chronic disease go through different stages, stage 1 to stage 5. The next session we'll discuss about the various stages of chronic kidney disease. Hope it was useful to you. Stay tuned for further episodes. Thank you.